So I'd like to thank Venkat and, of course, Lalit in his absence. He had to leave for another program. And Lupin for having given us this opportunity. We are now almost 1.5 hours into the program. And I think just to summarize, basically, we did discuss about the fact that about 20 to 30% of our patients with dyspepsia would have identifiable organic causes, but a large proportion totally unidentified. We are not able to identify any particular cause. In India, 20 to 40% of patients with dyspepsia would be having a functional dyspepsia. There was a reference to Rome 4 criteria, but I'm not very sure whether as clinical gastroenterologists, we do use Rome criteria for the diagnosis. But yes, it is used for research purposes. There's a lot of role which visceral hypersensitivity and gastric dysmotility plays. The role of gastritis also is important. The role of Helicobacter pylori is also very important. Of all the prokinetics, one among the many prokinetics, acoshamide, is there, and it is very gastrospecific. It is free of any side effects. It is free of any drug interactions, and the effect, even though a slow takeoff, the journey is smooth, and usually it goes on. It has been used for as long as 1 year or more without any decrease in efficacy or increase in side effects. And it has an impact both on gastric accommodation and gastric emptying. 100 milligrams 3 times a day is the dose that is recommended, but we can then switch over to once daily treatment. So thank you very much for this opportunity, and it is back to you, Dr. Gajanan, for the final words.
So as we conclude this enlightening scientific meeting, now I would like to take a moment to express our heartfelt gratitude to everyone. So before that, I'm very happy to announce that in today's meeting, the more than 1,000 doctors pan-India have joined. Firstly, now I would like to thank our chairperson, Dr. G.N. Ramesh, for taking his time out and making himself available for today's meeting and for sharing his expertise and insights with us. Also, I thank our distinguished speakers, Dr. Lalit Shimpi, Dr. Venkatakrishnan Iyer. Your insightful presentations have enhanced our understanding of functional dyspepsia and postprandial distress syndrome and use of acoshamide in management of this. I also thank our audience for joining us and for asking very pertinent questions, because of which the discussion has become very interactive and very much meaningful and practice oriented. So thank you for that. So with this now, we will close our session. Thank you very much. Have a great time ahead.
Okay.
Thank you. Thank you very much.
Good night to you all. Good night.
Yeah,
Good night.
thank you, sir. Thank you for accepting this, and a great session from Dr. Venkat and Dr. J. Ramesh and Dr. Lalit. Thank you, sir. So
Thank you.
Okay.
would like
Thank
to
you
see
very
you
much.
in the other coming seminars also.